Good morning, everyone. Welcome to the Meriwether County Board of Commissioners meeting for May 10th, 2023 at 9 a.m. If you will, I'll call this meeting to order. Please silence your cell phones and any other electronic devices. If you will, please stand for the invocation and remain standing for the Pledge of Allegiance. Invocation will be given by Pastor John Pape from the Luthersville Baptist Church.
Good morning. It's good to be with you. Just a word real quick, as I was asked to do this, a passage of scripture from 1 Timothy chapter 2 came to my mind, and I just wanted to encourage you, council, this morning. We're often as citizens always looking for you to do your job, wondering this, that, and the other thing, but the Bible mandates us to help you do your job through prayer. And this is an appointment of God, and it's a privilege for me to be here to lead you in prayer this morning. So if you would bow your heads with me and let's pray. Father in heaven, we thank you so much for your grace and your mercy, your goodness that you pour upon all of us here in Meriwether County. I thank you for this council, Lord, that you've put it on their hearts to be servants. And Lord, this is a work of God. You have ordained government. They've been duly elected by the citizens, but providentially appointed by you. And this is a good work. And I pray this morning that you would give them wisdom as they seek your wisdom for the goodness and the betterment of the people of this county. I pray that you'd watch over, protect them, guide their hearts and their minds. I pray your blessing upon each home that's represented not only here in this council, but also all those that are in this room this morning. And again, Father, we thank you for this good work. Give us the strength, the wisdom, and the guidance. And it's in Christ's name we pray. Amen.
Amen. Thank you. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Please be seated. Next item is to adopt the agenda. There are a couple of changes that need to be made. Under new business, item number 7, we will be removing. And we will be adding back an item number 7, and that is United Bank account for Lake Meriwether. Is there any other additions or changes need to be made? Hearing none, do I have a motion to adopt the agenda?
So moved.
Motion, do I have a second? Motion and a second, all in favor? Motion carries. Next item, presentations. We do not have any, correct?
No. Yeah, no, correct.
All right, next item, finance report, Mr. Beal.
Thank you, Mr. Chairman. You have the reports in front of you. General fund continues to look real strong, but I just wanted to point out for the new commissioners that the vast percentage of the revenue we collect is off of property tax, and we get that around November, December of the year. So even though it looks like we've got a lot of money in the general fund, the collections go down drastically as far as revenue goes the last 2 or 3 months of the fiscal year. So you'll see that 3.3 million reduced drastically over the next couple of months. I just wanted to point that out to you. Other than that, everything else looks pretty good. If you got any questions, I'd be glad to answer them.
Any commissioners have any questions? All right, thank you, Mr. Beal.
Thank you.
Next item is citizen comments. Do we have anyone signed up to speak?
Yes.
All right, next item are the minutes. We have 2 of these. The first one is for the April 25th, 2023, 4 p.m. work session. You all have had time to read those. Do I have a motion to approve those minutes for the work session? Motion. Have a motion. Do I have a second?
Second.
Motion and a second. All in favor? Motion carries. Next item under minutes is the April 25th, 2023, 6 p.m. regular meeting. We also need to approve the minutes subject to certifying the abandoned roadway from Twin Lakes Road, from Jimmy Clark to Rat Road, abandoned roadway upon the 30-day period that for the city of Gay has to pass a resolution requesting to take over the road. So we need to have a motion to accept the minutes as presented with this addition. Do I have a motion?
So moved.
Have a motion. Do I have a second? Second. Motion and a second. All in favor? Motion carries. Is that okay? All right. Make sure before we go on.
Can we mention that City of Gay already had a council meeting on it this past Monday night? They voted not to move forward at all. They have no interest in it at all. It's all been voted, approved, and settled.
Thank you. All right.
So you can do whatever we gotta do.
Good to know. Thank you. Next item is public hearing. No need. Next item, appointments. We have none till June. Next item, unfinished business. Item number 1, request from Lake Meriwether Advisory Board to purchase a storage building for Lake Meriwether. Do we have any additional updates?
Well, I've got a couple of prices on storage sheds and now I'm waiting on a guy to build us a shed to sort of match the building that the little lake house. So I'm still waiting on that and
Okay.
give me a price. And what I was gonna do was, furnish the rough sawn lumber and let him build it. So maybe at the next meeting, I'll have an answer on that.
Well, do you want to table it to our
Yeah, take it.
June night meeting? That way to give you plenty of time.
That'd be fine.
All right. So what is that? 23rd. So do I have a motion to table item number 1 under unfinished business until the May 23rd, 6 PM meeting?
May or June?
June. We in May.
You're in May.
So, yeah, June, I'm sorry.
You're confusing. me.
Yeah, I'm confusing myself. June 27th, 2023, 6 PM meeting. Do I have a motion to table until that point?
So moved.
All right, have a motion. Do I have a second? Second. Motion and a second. All in favor? Tabled. All right, next item, building inspection and plan review contractor.
Chair and board, I did make a copy of, well, somewhere in here. That is a little less confusing. It takes out the portion that is not the cost share amount since we're recommending cost share. So this is the cost share amount for the 3 vendors we discussed at the last meeting. We did get information back from our legal team on things that needed to be changed in the contract. Charles Abbott and Nova sent that in and has been reviewed by staff and those changes were made. We received safe builts this morning at 8:29, so we have not had a chance to review theirs.
What was the deadline on receiving those?
We didn't put a deadline,
Okay.
but we just said we needed them back before the meeting.
Say that we've been in 60%. On fire. But the next step is.
So do we have a recommendation or
My recommendation is the same recommendation I had last meeting, which was for Nova Engineering and Environmental at the 50%.
Nobody is here.
solid? All right, so hearing the recommendation from the county administrator, do we have a motion to move forward with Nova Engineering at the 50%, which is much lower than the other 2?
I make a recommendation to go with staff recommendations to go with Nova
All right,
at 50%.
have a motion. Do I have a second? I'll second. Okay, motion and a second. All in favor?
Staying because I do so much business with them.
Okay, and 1 abstain. Motion passes. All right, next item under new business. 2023-2024 health insurance renewal.
Chair and board, we do have Ms. Tammy Starkey here who is going to present the information that was sent to you. You have a copy of the 2023 benefit renewal package as well as the pros and cons for Anthem and UHC.
Good morning.
Good morning.
Morning.
Good to see you all.
You too.
So we're going to start by talking through what impacts the health insurance renewal, which is the claims that the county incurs versus the paid premium into the plan. So the first page of that packet you received does show our loss ratio, which is the comparison of premium versus claims over the last 3 plan years, year to date through January for this current plan year that started in July 2022. So you'll see last plan year that ended in June of 2022, we ended the plan at 81% loss ratio. So for every $1 that was paid in for claims, for premium, 81 cents was paid out for claims, which is very good, competitive with what we would want to see. And that is where our experience was when Anthem Blue Cross Blue Shield wrote the plan for this year, we were in a much better spot risk-wise. You'll see that for the current plan year, the experience that we have through January with Anthem, we are at a 162% loss ratio this plan year, mainly due to high-cost claimants. So we had a significant increase in high claims this plan year so far compared to last plan year. And high claims are accounting for 66% of our total claims expense. Majority of those we'll look at are related to some lifestyle related conditions, and we'll dig into that a little bit, but heart disease, diabetes, these types of ongoing conditions that we see on the plan. So at 162% loss ratio, we definitely expect to receive a renewal increase. The next page you'll see is just the rolling 12 months, because we do look back at a full 12-month of experience, and we provide that to Anthem to help levelize where we're at on those high claims, especially when we saw a spike in October of a high claim that paid out over $400,000. But still 129% loss ratio. The good news is that with Anthem, we are within the ACCG pool. So that means our risk is pooled with the other counties within that and underwritten together. So the pool ran at 85% loss ratio over the last 12 months. So definitely helped our experience. Without that, we would have expected to see probably 30%, 40% increase in our renewal premium. So it was beneficial to remain within the pool. Page 3, you'll see we did conduct a full marketing survey on all lines of coverage, but specifically on the medical, you'll see those carriers that did not submit a quote because they were uncompetitive based off of the experience on the plan and their network availability in the area for the members on your plan. We did receive one proposal from the market, which was United Healthcare. So we'll take a look at that. Page 4 is the renewal from Anthem. Original renewal was a 24% increase, about $323,000 in annual premium increase for the current plan. We were able to negotiate that to a 17.5% increase, which brings it down to $235,000 increase annually. So saving about $87,000 from the original renewal from Anthem. The next page 5 is the proposal from United Healthcare. So you'll see very similar plan design of what we have now. The plan has a $6,000 deductible. Members pay the first $1,500, and then the county pays the balance of that through a health reimbursement account. With that plan, United Healthcare is at an 8.9% increase, which is $120,000 a year. So the difference here between our current plan renewal with Anthem and the proposal from United Healthcare is about $115,000 in total. We did take a look at high deductible health plan options. How would that impact savings to the plans, overall membership, utilization of the plans, the county expenses, and the employee expenses? So you'll see on page 6 an example of a high deductible health plan. This is a qualified plan for health savings accounts. So with a health savings account, employees could put away pre-tax dollars to save on their overall medical expenses. But when we look at how do we balance this with what the county is funding currently towards the deductible, that the back end of the $6,000 deductible after an employee meets $1,500, we're averaging about $80,000 a year that the county's paying into that, because it's after someone incurs claims, and typically deductible claims on this plan are only inpatient and outpatient hospitalization, and only some outpatient, not all. Freestanding outpatient is only a copay, no deductible. If you move to a high deductible health plan, all services except preventive care are subject to that deductible, meaning that someone is going to pay out of pocket for every doctor's office visit, every prescription, every service procedure that they have until they meet that deductible. So one, you've got much more out-of-pocket expense for members. It's much more consumer driven, where you're evaluating what providers do you have the option to go to, what are they going to charge for specific services, because if you go to a specialist, that could cost you $200 for an office visit. Right now, they have a flat copay of $60. So more out-of-pocket expense, more member education needed, and also meeting that deductible much more quickly. So if we took that $80,000 that the county's paying towards the health reimbursement account and put that into the health savings accounts, that would mean we could fund about $700 towards that $5,000 deductible for employees. So again, much more member liability for the same type of cost plan. Also, we talked about being consumer minded, shopping your healthcare. We understand that employees and spouses, dependents within the county have less options to shop their healthcare with providers, with hospitals than an employer within Metro Atlanta would. So it's not as possible for someone to make selections on lower cost care when you have fewer options available within the community. The next page, we've got, I just tried to list out, I know there's a lot of options here, a lot of numbers. Let's talk the pros and cons, kind of bottom line. When we look at the Anthem medical proposal, a pro is the ACCG pooled underwriting. We definitely saw that benefit the county this year with our high cost claims experience. Again, we would have expected to receive a much larger increase if we were not part of that pool that ran much better than Meriwether County's experience. The outpatient freestanding facility I mentioned earlier is a $200 copay. So if I go in for an MRI, I go in for an outpatient procedure. If I go to a freestanding facility and not a hospital, you're just paying $200. Where the United Healthcare plan, they would pay the entire cost towards deductible. So that's a big plan differential. Overall, Anthem has better network access and better network discounts than United Healthcare. So how we evaluate that, especially on the medical side for our clients, is we look at the last 12 months of claims on those self-funded groups that we've got the details, and we reprice those networks. And in your area, in Columbus area, LaGrange area, we see that Anthem has better negotiated discounts with providers on medical and dental. So what that means is it may not impact your premiums today, but if you're paying less for a claim with Anthem than you would for United Healthcare, long-term, that impacts what your renewal looks like and what your claims experience look like. The wellness program, which is super important to the long-term stabilization of the risk on the plan, the high cost claims that we have. That Anthem has agreed to give us another $10,000 wellness fund, which your team has been using to fund biometric screenings, to fund incentives, purchase gym equipment, which is so important as we look at the lifestyle related conditions impacting your plan. Anthem also has an enhanced wellness program where members can receive $700 incentives for the employee and the spouse by participating in this. So getting their annual preventive services, tracking their activity, their nutrition, and using online coaching resources. And then Anthem has much more robust claims reporting where we can dig into what is driving costs. So United Healthcare will give us premium versus claims every month. They'll give us high claims every quarter. Anthem gives us the benchmarking of how you stand to other employers. They give us your lifestyle related conditions. They give us what utilization looks like by setting, what providers costs look by setting. So definitely much more in-depth analytics on what's driving the cost within the plan. Con with Anthem costs $115,000 more overall in total premium. And then with United Healthcare, the pros are, so they are packaging their medical proposal with all ancillary, so dental, vision, life, disability. So when we look at all benefits, voluntary life is not as robust in the guaranteed amount at open enrollment without health questions. It will give you the guaranteed amount without health questions, and then short-term disability guaranteed for 2 years. The cons, we talked about network disruption, not just on the medical side, but dental and vision based off of the top providers of your membership. We have had consistent formulary disruption, meaning that prescriptions are not covered under United Healthcare the same way they are with Anthem. And the experience in the past, the feedback from the employees and dependents on the plan was that they were not able to access medications that they needed, specifically diabetic medications. And that we see that change throughout the year. It's not set when we come onto the plan.
I have a question on that.
Yeah.
Why would they not be able to access it? If Blue Cross can access it, but UHC can't, if the medication's available, that makes no sense.
they're pushing them to a lower cost medication typically. So United Healthcare has a more tightly managed prescription formulary. And so instead of letting someone take a medication that they may have been on for years, they are pushing them to try or utilize those lower cost medications.
All their physician has to do is to write that it is to be the name brand, not a alternate on that. And the insurance companies have to take that by law.
Right, instead of a generic, but if it's a name brand to a name brand, there can be a big cost difference. And so,
But
yeah.
if their physician writes specific for that one and that there is no alternate medication for it, the health plan has to accept that.
Yeah, so, and that's an additional process that members have to go through. We also see many of the highly utilized medications are in a more expensive tier with United Healthcare. So while they're still covered, the cost is more for the patient.
So what I'm saying is for the employees to hear what I'm saying is tell your physicians to write specific if we go with the UHC. Go ahead.
Okay, sure. So pros and cons, and then on page 8, just wanted to again talk through the impact of lifestyle behaviors on our experience within the plan. So this is directly from Anthem's reporting, where we look at lifestyle behaviors like obesity, poor nutrition practices, lack of physical activity, tobacco use, and how those directly impact the claims experience on the plan. We are seeing, 21.6% of our claims experience so far this year are directly impacted by lifestyle related conditions. So a huge opportunity there to help educate members on how their decisions in nutrition and managing stress and exercise directly impact their health. So as we focus on improving the health of the population, then we see reduced risk within the plan and overall stabilization on some of these high cost claims like diabetes, like heart disease, even some cancers that can be related to lifestyle behaviors. So that would be our focus into the next year. On page 9, I just included a summary there of the Anthem wellness plan. So the incentives that members can receive, and again, this is employees and spouses can receive up to $700 by participating in the Anthem wellness program. That's built into the premiums. The incentives come from Anthem. And if we had all members participate, this is worth about $90,000. If everyone maxed out what they could receive. So again, preventive care, getting mammograms, their preventive physical every year, condition management, so coaching for weight, for physical activity, and then tracking their wellness activities. So page 10, recommendations for the July 1st, 2023 employee benefits renewal is to renew current plans with Anthem Blue Cross Blue Shield, to communicate and incentivize the wellness program that's available with Anthem, and to utilize that $10,000 wellness fund that is included with the renewal. Focus on those lifestyle related conditions, the education, the resources to improve the members' health, and then open enrollment for all elections or changes would be June 12th through 18th. Any questions?
Any commissioners have any questions?
I know we received the, I can't pull it up, for the, pros and cons.
Yes, it's in here. You want a
That
copy?
last one?
Yeah.
Do we have for everybody or whatever?
It's in this package as well, if you printed the package out.
Where?
Okay.
Be page 7.
Yeah, we don't have it.
I don't think we have.
The one that I sent out last night and the one that I sent out Thursday, not the original.
Okay.
Y'all know we're special. We don't put this stuff. Give it to Gene if he wants to look at it.
You want to make some copies?
It would probably help, just simply because I'm gonna be honest, I do not participate because I'm already covered. I'm old, Medicare, Blue Cross Blue Shield, federal employee. But anyway, with that being said, I wanted to see how it's affecting the different employees and if there's any feedback from employees. I see Patty standing.
like it.
Yeah.
You don't like
I'll state it flat out. It doesn't pay well for me.
okay, and there again,
And that's just one employee. We probably have several others that haven't come forward, if not more than that too.
the difference in the two plans and all, it sounds like, maybe cost savings on one, if you're doing the, the health savings, if they participate, but I don't know how many employees are participating in that, and I don't know out-of-pocket costs for employees.
Right. So I think the feedback we had when the county was with United Healthcare was that there was more disruption on being able to receive their medication. They were paying a higher cost for medication. At that time, there was network disruption because Wellstar pulled out of the United Healthcare network and there was no upfront communication on that. And so I think a lot of feedback came from that side of we weren't able to see the doctors we needed. We weren't able to fill the prescriptions that we needed. And that was kind of overarching with the United Healthcare experience. Now, Wellstar is back in the network. But I think it was a difference of how United Healthcare mishandled the communication of that network change versus how Anthem typically would handle that.
What's the recommendation?
Our recommendation is Hampton Blue Cross Blue Shield as well.
I don't see,
One of the largest things, like Tammy was talking about, is if there's outpatient surgery and an employee goes to that facility, it's a $200 copay versus what they would pay for a hospital stay. Because with United Healthcare, that's put towards the deductible. Well, that's huge when you have a major procedure done, and we don't want people avoiding doing things because of costs.
Yeah, an example would be like an MRI is typically at an outpatient facility. If with United Healthcare, they're going to charge the full cost towards the deductible, which is typically $700-800, just depending on where you go. And with the Anthem plan, there's the $200 flat copay if you go to a freestanding facility, meaning not a hospital, that would go towards outpatient care.
and that's a flat fee, no other billing coming later. Match the UHC 700.
Right. So there's always the opportunity of like a facility charge, but that's where our team steps in and acts as an advocate for the employee. If they do receive other billing, that we go back and determine how was it coded? Was it coded properly? We had that come up, I think, last week with the question of someone going into a clinic. The clinic is billing it as outpatient instead of clinic. So if it was billed as a clinic, it should have been billed as either a PCP or an urgent care copay. But since they're billing it as outpatient, it was applying back to that $200.
So even if you act as an advocate for that patient, there's no guarantee that the insurance company will say, oh, yes, let us go back in and have them to recode this in a proper way. The employee could still be responsible for that amount of money billed additionally.
It's always possible. We work directly with the provider or the facility to have them resubmit in a way that's going to benefit the member.
I don't see where Blue Cross is that beneficial over UHC, to be honest with what I'm looking at. I really and truly don't. The out-of-pocket is more for Blue Cross than it is for UHC. The county saves money with UHC. The issue stated about the pharmacology is a simple fix. It really and truly is. It just has to have your physician to write for that specific. I deal with that on a day-to-day basis. It's no big deal. To have any insurance company, they have to cover that. If your doctor writes it, there cannot be something exchanged. I know that the staff has recommended Blue Cross Blue Shield. I actually see a savings here for UHC. So what's the pleasure of the board?
When you say you see a saving, but also with that, you see a benefit, take care of the employees.
That's what I see.
Yeah, I said that I've had both, and it's so much easier to do this work.
And I might as well not have insurance there.
And I just wonder how many other employees we have that haven't spoken up and said anything, because we don't know unless they do, because they're the ones receiving the bill. Yes, Patty's my relative, and I'll probably catch hell saying, hey, you're back in that, but if we have one that is stating this, we don't know how many are really having the same issue.
Yeah, I'd like to defer to Valerie. She gets a lot of calls.
Yeah, I mean, I was familiar with Patty's situation and I helped her do research on it and, she's the only employee that's having an issue.
That has brought it forth.
That I'm aware of.
Right.
And I have lots of issues with United Healthcare. As far as employees coming to me and not being able to get their medicine. and stuff like that.
And when do we have to have this back to you?
We need a vote today.
Didn't we have this conversation last year?
Hey, blame these carriers.
I remember that conversation.
I know, we push as early as we can, but they definitely look for all the experience they can to underwrite it.
Just don't know. I know what they're recommending, I just don't see it.
With the difference that the county would have to supplement if we do go with, Anthem, would that be, bill back to I know it's the county would pay, but would it be a cost share with the employees? Or will we cover employees and let the employees cover their families at a higher rate?
We came up with a percentage years ago, using, employee portion, they pay 17.36% after the county paid the rest. And the spouse, they pay 38.38%. Children, 35.55, and family, 30.55%. If you run those numbers together, employees pay 25% of the package in the county, pay 75%. But we use these same percentages for the one current year renewal that will increase the employees.
Do we know approximately how much per employee?
Currently, for employees, 128.01. If you go with Anthem, it goes to 149.50, that's per month. And the UHC goes to 143.60.
With how much will this impact our employees? I mean, I imagine that with the we know all the costs are trending up. And I know that this may make a huge difference for some employees. If they're paying 128.01 now and then go to 143, is that what I'm hearing?
It's 128.01 with Anthem current. Stay with Anthem, it goes to 149.50. We go with UHC, we go to 143.60. It's gonna increase.
Okay.
Roughly $6 difference.
Because it's based
saving.
on that percentage, it'll increase for the employee.
But they're
plus-
out of pocket and deductibles are less with UHC as well than they are with Blue Cross Blue Shield.
They're the same.
No, they're not. I'm looking at it.
You might have an old copy, mine's the same.
Lord. I mean,
Well, from what I can see,
We have the pre-negotiated.
is the United Healthcare, you'd have to choose the choice, and it's 12.9% increase, is that correct?
Overall, it's 8.9 when we factor in, they give you a discount if you write the dental, vision, life and disability with them.
And then the Anthem is what, 17.5?
17.5. So it's a difference, a total $115,000, 25% of that absorbed by the employees.
I don't know a lot on this insurance stuff, but I have had several employees with the county call and text asking that they would love to stay with Anthem, so I don't know. You're out of here. I'm just kidding. She didn't like what I said.
Just throwing stuff.
I've had employees call and text saying they'd like to stay with Anthem.
Yeah, it is the same on hers, not on mine. I
Okay.
apologize. Who made these packets?
Well, I think that was the first presentation that came out, so since there, it did change with the negotiation.
We've had a few variations of it.
All right, yesterday?
And Thursday of last week as well.
And I personally have already, with my wife, and since I've come on board, have dealt with Anthem, and I've been pleased with the response. Some taking care of things, and they've got a lot of hidden benefits that you gotta search for and work for. But that's my opinion. There's 5 of us up here.
So what is the pleasure of the board?
I almost want a show of hands from the employees of.
There's not enough here.
You know, because this is classic case, it's not gonna affect me directly.
Right.
And with that being said, I want to make the best decision for the county as well as all the employees, because our employees should come first.
I agree 100%. And what I want to see, no matter what we do here today, Valerie, over the next year, I want you to have monthly conversations with employees to find out, are you having any issues with the insurances? Are you getting billed more than what you suspect? We need to have those conversations, because without that, we can't make a determination. We can sit up here all day long and say, oh yeah, this is what our broker person says is the best thing for us, but it may not be. It may look great on paper, but it may not be the best for those employees. So I want those conversations and documentation to be on a monthly basis with the employees. And we need to know what's working and what's not, because that's the only way we can make a decision. What works for administration and what works for the board of commissioners that partake in these insurances, it doesn't matter to me. I'd rather make sure that the employees are taken care of, because we are irrelevant.
And we can actually do that like through Survey Monkey, where we can send it out to the whole
I just
domain.
want conversations.
Yeah.
I think it's best that way. People will,
Many times,
Don't send the survey.
I'm not, I'd rather have, right. I just rather have the conversation. Valerie can have a monthly meeting in different departments and go in and talk to those that are utilizing it, and then make the documentation and give us a spreadsheet, maybe monthly or bi-monthly, something like that. But we do need to know that, because it is most important to take care of the employees, not us.
I agree with everything you just said, but
Today, we got to
don't
make a
have
decision.
Full employees here, and all I can go off is
I
the
understand.
ones that have reached out to me, texted me and called me. I'll be glad to make a motion to stay with Anthem.
All right, we have a motion for Anthem. Do we have a second?
I'm seeing a thumbs up from Brand.
Second.
Motion and a second. All in favor?
Okay.
Motion carries. All right.
Thank you.
Can I get an increase in pay?
No, but you need to get her direct number. Every time you get a bill that's too high, they need to advocate for you. All right. Item number 2, intergovernmental agreement regarding the conducting of the 2023 municipal general election with the city of Manchester. Patty?
Can we do 2, 3, and 4 all at one time?
Well, you can stand up there and do them, but we'll do one at a
Okay.
time.
The 3 agreements are the same. They're just one is with Manchester, one is with Warm Springs, and one is with Woodbury. They are the exact same. Greenville's was different because we conduct Greenville's qualifying. We will not be conducting qualifying for any of these cities.
Okay.
And this is just to conduct their November general election.
Okay. That's it.
That's it.
Any cost to us, or
No,
they pay for it?
I'll,
All right, gotcha. All right. Item number 2, intergovernmental agreement with the city of Manchester. Do we have a motion?
So moved.
Have a motion. Do we have a second?
Second.
Motion and a second. All in favor? Motion carries. Item number 3, intergovernmental agreement regarding conducting of the 2023 municipal general election with the city of Warm Springs for the November general election only. Do we have a motion?
So moved.
Have a motion. Do we have a second?
Second.
Motion and a second. All in favor? Motion carries. Item number 4, intergovernmental agreement regarding the conducting of the 2023 municipal general election with the city of Woodbury for the November general election only. Do we have a motion?
So moved.
Have a motion. Do we have a second?
Second.
Motion and a second. All in favor? Motion carries. Thank you, Patty. Item number 5, approval by Board of Commissioners for deeds executed by owners on Beulah Evans Road for paving Beulah Evans.
this has been a very long process, Chair and Board. We have sent those executed deeds over to legal for review. I did speak with Nathan and Michael. They had reviewed them prior to them going out. So it's more just, I think, at this point, looking and making sure the signatures and everything is good, which, yeah. So did everything look good? Okay, perfect. So we would like to ask that the Board of Commissioners vote to approve the executed deeds so that we can put them on file and move forward with the process for Beulah Evans Road paving.
And we have all of them at this point?
We have all with the exception of one.
Okay.
And we have a process that we will be working on for that one.
Any commissioners have any questions? Before I ask for a vote, I do want to recognize Ms. Marcel Womack. She has done an exceptional job. She has busted her butt for 2-3 years now to try to get all signatures done in an effort to get our first paved road in this actual condition. So I do give you kudos for everything that you've done and thank you for working with us and being patient. So do I have a motion to approve the executed deeds?
So moved.
I have a motion. Do I have a second?
Second.
All right, motion and a second. All in favor? Motion carries. Item number 6, request from probate court for gun permit processing with Eagle Advantage Solutions.
Chair and Board, Jamalto, it was our current contractor and Judge Rasnick couldn't be here today, so I'm going to present this for him. They went out of business last week, so he needs a processing company so that he can continue the renewals of gun permits. He cannot do that right now because he does not have a company. So he's attached a quote from Eagle Advantage in Carrollton. They are local and many of the surrounding counties are hiring them as well. The cost is the initial fee of $8,556. In 2 years, the annual fee will be about $2,300 yearly after that. The initial payment does include the first 2 years of service. So we're looking for approval of this as well as a funding source.
And you did say this is the same one that the jail uses, correct?
Correct, yes, sir.
Any commissioners have any questions?
Just what funding source?
Usually when these software upgrades and additional purchase price, we fund from squad and then budget. I would suggest a five.
Any other questions? Hearing none, do I have a motion to accept the request from the probate court for the gun permitting process
So moved
with
with,
funds from SPOS? Sorry. Is that what you want to say?
that's what I was gonna say.
All right. Have a motion. Do we have a second?
Second.
Motion and a second. All in favor? Motion carries. Item number 7, request from Lake Meriwether for United Bank account.
I'll take that. So what we're doing now is, Mr. Robert collects all the fees from the Lake Meriwether and that come in. And he takes them home to his house, and then once a month he comes up to the office and we count the money and deposit in the bank. The last couple of 3 months it's been a large sum of money that he keeps in his house, and he's getting pretty nervous about that. So he asked if we could open up a bank account at United Bank in Woodbury, and the way it would happen is we'll open the account with the board's approval. Then he'll just go over there with his 3 bags of money and make 3 deposits, and then supply us with the deposit tickets of which one of the 3 categories he has. And it's basically the same thing we do now. It's just the bank does the counting and ours doesn't have to.
So daily basis.
I don't know if he'll do it daily, but at least
Because I'll say this, I did not know that money was going home with somebody, and I do trust Mr. Robert, but I don't think the county money should ever be there. If something happens, we have no proof that that was county money versus personal money. So if we're gonna do this, it needs to be deposited on a daily basis.
okay, we can make
For that reason too, but, and he deserves that $100. We just gave it $100 raise to help his traveling back and forth here, but that's fine. He needs that. But I don't see why as a business person, I don't see why on a daily basis or however, whenever he collects, whether he collects it every day or every 3 days, why he doesn't collect it, go to the bank and make a deposit.
That's what we'll do.
He could turn the deposit slips into y'all once a month or
Sure,
something like
that'd be
that. But as
fine.
long as that money is daily, I don't think it should be going home because during the summer months, I know there's quite a large amount. It's not safe for him and it's not very beneficial for the county to do it.
Well,
like
not
that.
that if somebody,
Right.
comes along, wants to open records about this and that, on money and so forth, this gets deposited daily, go pops to the bank, the deposits. So
Right.
be good. I'll make a motion. We have that account set up for it.
with daily deposits.
the daily deposits.
All right, have a motion. Do we have a second?
Second.
Motion and a second. All in favor? Motion carries. We got one abstain.
Oh, abstain. Okay, thank
He's
you.
on the board.
Yeah, that's right.
All right, next item is proclamation, Community Action Month. I have it somewhere. Hold on. All right, Community Action Month proclamation. Whereas community action has made essential contributions to individuals and families across this nation by creating economic opportunities and strengthening communities. And whereas community action is a robust state and local force connecting people to life-changing services and creating pathways to prosperity in 99% of all American counties. And whereas community action builds and promotes economic stability as an essential aspect of enabling and enhancing stronger communities and stable homes. And whereas community action promotes community-wide solutions to challenge throughout our cities, suburbs, and rural areas. And whereas community action delivers innovative services and supports that create greater opportunities for families and children to succeed. And whereas community action insists on community participation and involvement, ensuring that all sectors of the community have a voice and will be heard. And whereas through programs and services, Community Action for Improvement, or CAFI, Inc. staff strengthen the lives of their families, communities, and the Carroll, Coweta, Heard, Meriwether, and Troup counties as a whole. And whereas Community Action is celebrating 58 years of innovation, impact, and providing proven results for Americans, now therefore the Meriwether County Board of Commissioners do hereby proclaim May 2023 as Community Action Month in recognition of the hard work and dedication of Community Action for Improvement, Inc. in Georgia. Urge citizens to thank CAFI for their service and the ways to give back to their communities. In testimony whereof, I have hereunto set my hand and caused to be affixed the Great Seal of Meriwether County, Georgia, on this 10th day of May 2023. Anyone have anything to add?
No, unfortunately, she could not be here today, but this does mean a lot to the community, and surrounding counties are doing this as well for Community Action Month.
Any commissioners have any statements? All right. Next item is report from County Administrator.
Thank you, sir. Lead abatement at the courthouse should be complete this week, and the work will continue through the end of the month. We are setting up an office for the coroner over at 911. The framework's been done, and we hope to start hanging some sheetrock here soon. The courthouse wall, sidewalks, stairs, and walkways were pressure washed over the weekend. I sent a video as well as some pictures, and if you get a chance to go by, it has made an incredible difference. We are also working with NFP, which was Miss Tammy Starkey, to come up with a total compensation package for employees. So when they're looking at their salary and hourly rates, it's not necessarily excluding some of the benefits that may or may not be offered at other places. RFPs are out for River Cove Road at Tarver Branch and Strickland Town Road at Pine Woods Creek. They are due back June 15th. Dukes Walldale Road is complete. It will be advertised next week, so we'll be a week out on that one. And we are currently working on the RFP for the on-demand contractor. Joint comprehensive plan today at 2:00. Let's see. I think that's it, with a few dates just to remember. On May 18th is the mandatory pre-proposal meeting for the jail roof. On 5/19 is the bid opening for the LMIG projects. And on May 26th, which will be after our next meeting, is the jail roof proposal opening. So those are some dates coming up.
All right, thank you.
We have to wait till that comes out in the paper, or can we start sending out contractors?
We send it out automatically
Okay.
to the contractors on file. If you have anyone that you would like to add to that or anything of that nature, just let us know. And then we advertise it in the paper for at least 2 weeks.
Any commissioners have any questions for the administrator? All right. Next, we have a report from county commissioners. Commissioner Collins.
Yeah, I'd like to thank all the county employees for the job they've done. And last night we had the board meeting at the lake. Alan McKinley has been wanting to put T-pads on the disc golf. She had a price from the guy, I guess, that installed a disc golf of 8,500. Well, I reached out to Mr. Carter, Michael Carter in Woodbury. He gave us a price of 48.75. So I guess Mr. McKinley's gonna go with his price. And other than that, that's all I have. And Peaches in the Pines is coming up June the 10th. So hopefully everybody will attend that.
All right,
Thank you.
thank you. Commissioner Plant?
As always, I want to thank the employees and all for, especially on roads and all, which continue to be a problem. I appreciate the roads that are being opened and, hopefully we can get some work done through the bid process on, some of the other roads. The other thing is I had, announced, because they fully anticipated the kids fishing event this year at the hatchery. And I have reached out, and because of the pond reconstruction work, they will not be able to have it this year. And I kind of suspected that when I saw the Facebook post where they had taken a load of catfish up to the state park. So hopefully you can go fishing up there with your family at the state park. So with that being said, thank you. And I look forward to the comprehensive planning meeting this afternoon. Hopefully we can make some progress on that because we are running behind so far, but that is at 2:00 today. Thank you very much. Yes.
Commissioner King?
The cotton pick fair, or the cotton fair now over in Gay, was a success this weekend. A lot of people came in, visiting our county. That was great, beautiful weekend. So that was nice to see. I got my citizen staffs are very, on top of things and reminded me every day, which roads need to be repaired. So I want to thank them for all their hard work and letting me know where I need to be at. So we are working with Bill and Barry, and I'm trying to let them know that we've only got, we got a motor grader guy in training. We only have one motor grader on one side of town, but we are coming. I keep promising we're coming, but at least when they do see some major issues that could be very dangerous, they notify me quick as their commissioner, and I pass it right on, and we're getting great response. So again, thanks to all the employees for what they're doing. I know everybody's overwhelmed right now, short on staff, but you can't thank them enough. I hope that they appreciate, they know we appreciate what they're doing for us, even though they're paid employees, but we do appreciate everybody that works from Meriwether County.
All right, and I'll just say that Commissioner King and I had spoken about trying to do some type of fireworks back at Lake Meriwether. We used to do that a long time ago until the sheriff changed, and we don't do that, but Manchester still intends to do the fireworks this year in Manchester. I did speak to them. So what we would like to do between now and next year is all the cities probably come together, see if they can donate somewhat and see if we can't get it back with funds from the county too, to do something at Lake Meriwether. It's going to provide the fishing, things like that for families to do too. We're not trying to take anything away from Manchester, but maybe bring the entire county together centrally. So Manchester will be having the fireworks this year, probably around July 3rd. That's usually the day they do it. But we did speak about trying to get the funding up to do it and bring everybody together.
That's a good idea, because if we do it out Lake Meriwether, and it's a county thing, it's central located, a lot of folks can come on out there early and not just come and watch fireworks, go home, but they can just spend the day out there and fish and play and have a good time, and have a little family reunion, whatever. I just think it'd be I know Manchester reached out to different ones asking for sponsorships, right? If anybody would like to help sponsor your company, your business name with Manchester, they are looking for that, but I think we should be doing something as a county too.
Lake Meriwether is our Callaway Gardens in Meriwether County. So there you go. That's all I have. Next item is report from county attorney. Do we have any need for executive session?
We do. We need executive session for litigation, personnel, real estate, and tax matters.
Well, the whole
Whole gamut. I would like, if you would give me the opportunity, I did forget that Ashley Harmon had sent me information from 4-H, so I do want to announce that as well. They've been very busy with onions, as you can imagine, over 8,000 pounds. So she wanted to say a huge thank you to the board, Barry Lucas, Alphonse Peinberg, Robert Schelleberger for assisting in getting all of that, as well as the inmate crew helped unpack that. But it's a lot of onions. She's been very, very busy. We're all going to enjoy those. 4-H will be representing or I'm sorry, presenting awards at honors days in the upcoming days. Over 50 4-Hers will be attending the 4-H camp this summer.
Very impressive. She's done a great job since she's been here. She really
I like
has.
to add, I forgot something also.
Sure.
With the board's permission, or you may have to vote on it, I met with the forestry out at Lake Meriwether. In the area down in there where the disc golf is, I would like to burn that off.
I don't know. Can we check on that?
Yes,
Okay.
we'll check
Ms.
on
Bell
that
will check
because
on
I'll
it.
get with the fire department and they
Yeah.
can coordinate with forestry and
But
see. what-
somebody's got to light it. They won't light it.
That's fine.
I love fire. I like it. I like it. I'll take it.
You can go to Maddox.
We are,
You bring a gallon of gas and I'll bring it.
Won't light it.
I like it.
we're in a burn ban right now. So I'll get,
No, they're burning, they burnt 250 acres next to me yesterday.
Control burn.
You can burn right now. You don't even have to get with the fire department. You gotta, when you can ask them as a respect.
I got in touch with the forestry and
Right.
they came out, we looked at it. There's only one little small section from the road down to the creek. And so that you have the creek bordered on the south side, roads all around and, you know, they
It's-
said it wouldn't be any problem.
Forestry department was out there yesterday on my road because somebody called me and said, hey, there's a big fire over here. And I called 911 and they go, it's a controlled burn. So as long as they communicate with the forest department and make a phone call to 911 and the fire department, so nobody freaks out.
Well, you, Emmett, the fire department and the forestry do it, and then the three of us don't have to worry about y'all burning anything. That's right.
thank you. I appreciate that. Get that taken care of.
All right. The future meetings are May 23rd, 2023 at 6 PM and May 29th, 2023 will be closed for Memorial Day. Having nothing else on the agenda, do I have a motion to go into executive session for the purposes of litigating
Motion.
personnel, real estate, and tax matters? Have a motion. Do I have a second? Motion and a second. All in favor? Motion carries. We are in executive session at 9:56.
Okay.
Do I have a motion to go back into regular session? Motion. Have a motion. Do I have a second?
Second.
Motion and a second. All in favor? Motion carries. We are back in regular session at 10:54. No action was taken in executive session. Is there anything else to come before this board? Hearing none, do I have a motion to adjourn? Have a motion. Do I have a second?
Second.
Motion and a second. All in favor? Motion carries. We're adjourned.